Hello guys, how are you? I think so you would be fine and enjoying good health. Today I selected a topic on sinus infection which is called as sinusitis. Sinusitis is an inflammation of the sinuses that can cause them to get blocked and filled with fluid. It is usually caused by cold or allergies, and infection could result from the blockage. And what is sinusitis? This is an inflammation or swelling of the tissue lining the sinuses. The sinuses are four paired cavities, spaces in the head, and they are connected by narrow channels. And the sinuses make this thin mucus that drains out of the channels of the nose. This drainage helps keep the nose clean and free of bacteria. Normally filled with air, the sinuses can get blocked and filled with fluid. When they happens, bacteria can grow and cause an infection which is called as bacterial sinusitis. This is also called as rhinosinusitis, with rhino meaning nose. The nasal tissue is almost always swollen if sinus tissue is inflamed. And there might be maxillary sinuses, frontal sinuses, phoenoid sinuses, ethmoid sinuses. What are the different types of sinuses near the nose and eyes? The paranasal sinuses are located in your head near your nose and eyes, and they are named after the bones they provide their structure. The ethmoidal sinuses are located between your eyes. The maxillary sinuses are located below your eyes. The sphenoidal sinuses are located behind your eyes, and the frontal sinuses are located above your eyes. The biggest sinus cavity is the maxillary cavity, and it is the one of the cavities that most often becomes infected. And there are different types of sinusitis, such as acute bacterial sinusitis. This term refers to a sudden onset of cold symptoms such as runny nose, stuffy nose, and facial pain that does not go away after 10 days, or symptoms that seem to improve but then return and are worsened than the initial symptom term called double sickling, and it responds well to antibiotics and decongestants such as rhinerge and rhinosone. Chronic sinusitis this term refers to a condition defined by nasal congestion, drainage of facial pain, pressure, and decreased sense of smell for at least 12 weeks. And then is this subacute sinusitis. The term is used when the symptom lasts 4 to 12 weeks. Recurrent sinusitis this term is used when the symptoms come back 4 or more times in 1 year, last less than 2 weeks each time. Who gets sinusitis? A sinus infection can happen to anyone. However, people with nasal allergies, nasal polyp, asthma, and abnormal nose structures are all more likely to get sinusitis. Smoking can also increase how often you get a sinus infection. There are an estimated 31 million people in the United States with sinusitis. It can be difficult to tell the difference between the cold, allergies, and sinus infection. The common cold typically builds its peaks and slowly disappears. It lasts a few days to weeks, and cold can transform into a sinus infection. Nasal allergy is inflammation of the nose due to irritating particles, dust, pollen, and dander. Symptoms of a nasal allergy can include sneezing, itchy nose and eyes, congestion, running nose, and postnasal drip, mucus in the throat. Sinusitis and allergy symptoms can happen at the same time as a common cold. If you are fighting off a cold and develop symptoms of a sinus infection or nasal allergy, see your healthcare provider and ask and describe your symptoms, medical history. What causes a sinusitis? Sinusitis can be caused by the virus, bacteria, or fungus that swells and blocks the sinuses. A few specific causes include the common cold, nasal and seasonal allergies, including allergies to molds and polyps, growths, a deviated nasal septum. The septum is the line of the cartilage that divides your nose. A deviated nasal septum means that it is not straight, so that it is closer to the nasal passage or on one side of your nose, causing a blockage. And then a weak immune system from illnesses or medications. For infants and young children, spending time in daycares, using pacifiers, or drinking bottles while lying down could increase the chances of getting sinusitis. For adults, smoking increases the risk of sinus infections. If you smoke, you should stop. Smoking is harmful to you and to people around you because of passive smoking. Is sinusitis is contagious? Yeah, you cannot spread the sinusitis, but you can spread viruses that lead to sinusitis. So remember to follow the good hand washing practices to avoid people if you are sick and to sneeze or cough into your elbow, or if you have to sneeze or cough. What are the signs and symptoms of sinusitis? There might be some symptoms that might include post-nasal drip, mucus drip down the throat, nasal discharge, thick yellow or green discharge from nose or stuffy nose, and the facial pressure, particularly around the nose, eyes, and forehead, headaches and or pain in your teeth or ears, halitosis, which is bad breath, cough, and the tiredness and fever. How is sinusitis diagnosed? Your healthcare provider will ask you a lot of questions in order to develop a detailed medical history and find out about your symptoms. This may also do a physical examination, and during the exam, your care provider will check your ears, nose, and throat for any swelling, draining, or blockage. An endoscope, a small lighted optical instrument, may be used to look inside the nose. In some cases, you might be referred to an ear, nose, or throat ENT specialist. If you needed an imaging exam, your provider would order a computed tomography CT scan. Sinusitis is treated in several ways, and each depending on how severe the case of sinusitis is. Simple sinusitis infection is treated with decongestants, over-the-counter cold and allergy medications, nasal saline irrigations, drinking fluids. Sinusitis is a viral infection, fluids will help. If symptoms of sinusitis do not improve after 10 days, your doctors may prescribe antibiotics for 7 days in adults and 10 days in children. Oral or topical decongestants. Prescriptional intranasal steroidal spray. Don't use non-prescription sprays or drops for longer than 3 to 5 days. They may actually increase congestion, which is called a rebound phenomena. Long-term chronic sinusitis may be treated by focusing on the underlying condition, typically allergies. This is usually treated with intranasal steroid sprays, topical antihistamine sprays, or oral pills, and cromolyn compounds, leukotriene antagonists to reduce swelling and allergy symptoms. Rinsing the nose with the saline solution that might also contain other types of medications. When sinusitis is not controlled by one of the above treatments, a CT scan is used to take a better look at your sinuses. Depending on the results, surgery may be needed to correct the structural problems in your sinuses, and this is most likely happening if you have polyps or a fungal infection. What complications are associated with the sinus infection? Although it does not happen very often, untreated sinus infections can become life-threatening by causing meningitis or infecting the brain, eyes, or nearby bones. And meningitis is infection of the brain of the meninges that cover the brain and spinal cord. Many sinusitis infections are caused by viruses, the ones that cause the common cold. These types of infections are not cured by antibiotics. Taking an antibiotic for a viral infection necessarily put you at risk for side effects related to the antibiotic. In addition, the overuse of the antibiotic can lead to antibiotic resistance, which may make future infections more difficult to treat. Complementary and alternative therapy is useful for treating sinusitis. You might find acupuncture of the facial massage helpful in reducing symptoms of sinusitis, including pressure and pain. They might also help you to relax. These treatments do not usually have unwanted side effects. Is there any way to blow your nose? If you have a stuffy nose, trying to force yourself to blow your nose could make it worse. The best thing to do is to blow one side of your nose at a time gently into a tissue. You might want to first use some types of nasal rinse to loosen any material in your nose before blowing, making sure you dispose of the tissue and then clean your hands with soaps and water or antimicrobial sanitizer. Some of home remedies used to treat sinus infection symptoms may help prevent sinusitis. These include rinsing your nose out with salt water and using medication that your provider might suggest, such as allergy medications such as fexofenadine or terfenadine, Avastin, Castine, and Avil, chloropropamine, and like these drugs, and Atarex, and steroidal nasal sprays, which are decongestant sprays. You should avoid using things that you are allergic to, like dust, pollen, or smoke, and try to avoid sick people and wash your hands to reduce the chance of getting cold or flu. If you have indoor allergies, it is recommended that you avoid triggers, animal tenders, and dust mites, for example, as well as take medication. Smoking is never recommended, but if you do smoke, strongly consider a program to quit it. Smoke can also trigger allergies and prevent removal of mucus by the nose. No special diet is required, but drinking extra fluids helps to thin nasal secretions. It is pretty easy to care for most sinus condition on your own. However, if you have continued the symptoms that concern you, or if your infection continues to happen, your primary care provider, healthcare provider might suggest you a specialist, and this could also happen if your CT scan shows something that does not look right, or if you have a hypertrophy of the uh, nasal sinuses or paranasal sinuses, or hypertrophy terminates. So it was all about the sinus and its symptoms and its treatment. So I think so that it will be a more informative topic that we have discussed, and you would have liked this video. And if you have liked this video, then don't forget to subscribe it. And thanks for watching my video, and have a wonderful nice day. Thank you very much.